Hi there, how are you? This is Loise. Welcome back to my channel. It's my hope and trust that you're doing well wherever you are. If this is your first time here and you haven't subscribed, please do subscribe. Today's video is about nursing and other 12 occupations that are in demand in Canada. Please note, I said nursing and other 12 occupations, and this is Canada-wide. This is not for a particular province. As you know, there's a lot of hype about nursing in Canada, and it is warranted. And I just want to make a disclaimer that I have nothing against nursing or nurses. I love nurses. About 50% of my friends are nurses, and I adore them. I also want to say at this point that myself and a lot of other people just want to take this opportunity to salute all people in healthcare, especially in this season of COVID-19. Okay, you guys are our heroes. We just love what you're doing. Please continue doing and be safe. Okay, all right. So when it comes to immigration, when people are looking to come to Canada, and I'm just talking from my experience, especially coming from where I come from. I don't know about other continents, but mostly I know about Africans, I know about Kenyans. There's a very big hype about doing nursing abroad. And there's an idea, I don't know whether it's a misconception out there, that one of the main ways that you can go abroad is by being a nurse or being in the nursing field. And to say the truth, healthcare jobs are in demand abroad, and especially in Canada because of the aging population. So these healthcare jobs are always in demand. But guess what? It's not just nursing that is in demand. But it seems like there's a memo that I missed somewhere, either before I immigrated, even when I immigrated here. It feels like there's a memo that I missed. Because I cannot tell you just how many people told me to join nursing. People feel like it's easy to get into nursing, whether it's in school or whether you just landed in Canada and you want to reinvent the wheel, you want to go back to school, you don't know what you need to do, and people will a lot of times tell you to do nursing. I have consulted with hundreds of people who always mention nursing, like they are looking for a course to come to do in Canada, and they want to change their professions totally to come and do nursing in Canada, and there's nothing wrong with that. But a lot of these people, when I look and I talk to them, they tell me they want to do nursing as a means to a destination. You understand? Like, they're not doing nursing because that is what they love to do. These are people who have degrees, who have certificates, who have wealth of experience in other fields, but they feel like nursing is a means for them to get here. And also, when you arrive in Canada, some people tell you that it's easier to get into nursing, and it's not easy to get into nursing, my friend. Getting into nursing school is rigorous. Very, very, very rigorous. Also, the nursing course is not easy. I have seen my friends study, and that thing is hard. Okay? But that is besides the point. What I want to talk about is you want to get into nursing for the right reasons. I would want you as a potential immigrant or as a newcomer to Canada to get into nursing for the right reasons. Because when you do things that you love, when you do things that you're passionate about, you excel and you perform well and you enjoy your job. Don't just do nursing because it pays well. Don't do nursing because you're assured of a job. Don't do nursing because it's an easy way to get you to Canada. Because I think those are the wrong reasons. Okay? You want to do nursing because you admire nurses. You love to be a nurse. You are born to be a nurse. I used to say that nursing is a calling. And I knew that a long time when I was a small girl, when I used to look at my teachers and the nurses. Those are two professions that I looked at a lot because in my family, I have a lot of those. And I said, you know what, nursing is not for everybody. It's definitely not for me and a million other people out there. I'm the kind of a person who just cries. You know, I see sick people and I'm just crying. You know, I see a wound, a big one, and I see blood and I faint, right? So people like us are not called to be nurses. As much, the only thing we know how to nurse, maybe heartbreaks and stuff like that. But nursing is not for everybody. So just evaluate yourself and see, is nursing for you? Before you get into nursing, whether it's getting into nursing school or whether it's changing your career to be a nurse, please do it for the right reasons. Do it because nursing is deeply rooted in you. And then that way you can and this is for entry level. I'm not talking for advanced nursing. I'm just talking about entry level, which is either LPN or registered nurses. So do that because it's what you love to do, and I tell you, you're going to love it. And nursing jobs in Canada, they pay well. They are really good jobs to have here in Canada, and there's a lot of nursing jobs. Okay, all right, but guess what? Huh? There are other occupations in healthcare that are in very high demand in this country. And these jobs, I'm not talking about doctors, no, surgeons. I'm not talking about spending years in residency and stuff like that. No, no, no. I'm talking about other jobs in healthcare that you can enjoy, that at times you can even transition from your wealth of experience and combine them with healthcare, and you can excel and do things that you love to do. Okay, so these jobs that I'm going to talk about, including nurses, you're going to find that almost all of them are licensed here in Canada, and usually there's no one single license. There's going to be a jurisdiction license. So you're going either to be licensed in the province of, your province. So you may be licensed to work in Ontario, but you're not licensed to work somewhere else. So just make sure that you're seeking the right license for the province that you want to settle into. Okay, all right. So these jobs also, I'm gonna talk about some of them, they may require masters, and some don't even need a degree. You can get into them, you can get your foot in there with just a diploma. Okay, these are not easy jobs. I'm not saying they are easy jobs, but they are wonderful jobs. They can give you a lot of satisfaction, and the best part is they pay just as well or even better than nurses. Okay, so, and some of these you may be interacting directly with clients, and some of them you just may be working in an office doing your 9 to 5 if that is your kind of thing. And all of them, by the time you have about 2 years of work experience, these jobs they are going to be paying over $70,000 a year. They could pay more depending on what it is, but they are well-paying jobs. Okay. All right, number one is healthcare management. So healthcare management ranges a lot depending on the kind of an institution, administrators all over. But healthcare management in Canada is just not confined in hospitals. No, it's in hospitals, it's in facilities for aged care, long-term care, mental illness care, disability care, youth care. It's everywhere. So these are institutions that have integrated healthcare, and those are places whereby you can practice your healthcare management. You're going to need at least a degree, but these jobs pay well. Okay, all right. Number two, it's healthcare IT. IT today IT is our today and it's our tomorrow. So if you can incorporate healthcare and IT, you have that medical background, and then you have that IT capability, you can excel here from design to analytics. You can be a consultant, you can do informatics, you can do data analysis, business intelligence, anything. There's so much that you can do in healthcare IT. Okay, and for that you're going to need at least a degree. Okay, all right. Number three, dental hygienists. Yes, these are the good people who work at the dentist office, and they do cleaning and scaling. And for this job, you don't even need a degree. You're just gonna need at least 3-year diploma, and I tell you, this job pays well. Yes. Okay. Yes, this is a really good job. Number four, medical radiation, whatever you want to call it, whether it's sonography, ultrasound, whatever, x-ray, all those diagnostics. This field is in such high demand in Canada, and guess what? You don't need a degree. If you have a degree, well and good, but you can get into this field with a 2-year diploma and 1 year of practice. Okay? Internship 1 year, 2-year diploma and 1 year internship, and you can thrive in this field. Number 5 are lab technologists. Lab technologists, they are always in demand all over Canada, and you're going to need at least a degree to enter this field. Okay, at least a degree. I know some people who get there with a 3-year diploma, but a degree gives you better leverage. Okay, all right. Number 6, cardiotechnologists. Yes, that is a good course that you can do, you can take, and you don't need a degree to get into this. You just need a 3-year diploma, and the pay is good. Okay. Number 7, respiratory therapists. What a better time for respiratory therapists. You know, there's a season for everything, and I think this is a season for these people to shine with this COVID-19. But I also think that this field is going to thrive as we go forward, because we don't know the fate of this COVID-19 thing. So this is a good course that you may want to look at if you're looking for courses to do or areas to venture into. Respiratory therapist, you do not need a degree to set your foot into this industry. A 3-year diploma is going to be just enough. All right. Number 8, of course, you know, pharmacists, they are in demand everywhere, and this is a good career. And to be a pharmacist, you're going to need at least a degree. Okay. Yes, number 9 is occupational therapists. Yes, there's so much work for occupational therapists all over Canada, from sports to anything, you know, all kind of injuries. They're going to be needing occupational therapists, and you are going to need, for occupational therapists, I believe you're going to need at least a degree. Okay. Number 10, physiotherapists. That goes hand in hand with occupational therapy, but now these ones are into physical therapy, and you're going to need at least a master's to practice as an as a physiotherapist, especially I think here in Alberta. So you need to check your province to see exactly what is needed for you to be able to practice with a license. Okay, and it pays well. Number 11, massage therapists. The same thing, you know. The good thing with this country is we have extended health. In a lot of companies, employees do enjoy extended health benefits, and these are the benefits that are not paid for by, let's say, by the federal healthcare, let's say like the Alberta Health here. So Alberta Health is not going to be paying for your physiotherapist or your massage therapist, but a lot of organizations do offer that extended health benefit that lets people take these kind of sessions, and most of them do direct billing. So you're going to find that there's a lot of work for massage therapists who do their job well, and professionally physiotherapists, there's a lot of work for these people, and the pay is good. And guess what? To be a massage therapist, you do not need a degree. You need 2-year diploma and some internship. Okay, number 12, the final one, it doesn't mean that this is all there is, but this is my research. That is healthcare insurance. Yes, there's a lot of work here in healthcare insurance, from benefit analyst. You're going to need some insurance license to be able to operate in this, but that is a nice way that you can integrate your insurance background with healthcare to be able to look at all the insurance stuff here and claims and stuff like that. Okay, and this pays well, and you may need a degree for your insurance license. Okay, all right, so this is from my perspective. I just did my own research on this. I just want to say something before I end this session. I have seen that from our African, and I'm just going to be very careful here, please don't crucify me, but I'm going to say that I have seen that from our African background, a lot of our people come here to do nursing. And I say there's nothing wrong with that. a majority, if you go to hospitals, you know, if you go to a lot of these places, most of the nurses are Africans. Okay? There's a lot of them. However, we can take it a little, a step further if we want. I have seen people who come here, they are immigrants, and they do nursing, and they just don't stop at nursing. Like, I've seen people who are doing doctorate in nursing. Oh my goodness. Yes, people go deep and deep and deep, which is really good. But I feel like in healthcare, it's one of the places whereby we can integrate our Canadian dream and go further. And when I say go further, I have seen a lot of consultants in healthcare, but I have not seen people from our African background into a lot of these places. They are there, but we are not so much. Like when you look at the people who practice physiotherapist, occupational therapy, there's a lot of Indian community. Those guys, they come here, they do these things, they start their own practices, they start their own clinics. There's so many of these clinics that are owned by Indians, and I just want to motivate or just talk to someone from my background that, what, we can go that step further. Healthcare doesn't just stop at nursing. That's all I want to say. Healthcare doesn't just stop at nursing. There's so much you can explore and excel, and guess what? We can make a change. I really like to see our people thriving, and it would be nice when I go for my my massage or my physio, or whatever it is. I would really love to be served and to see our people who are doing these things, who are practicing and who are excelling, and they're working in these jobs with a smile, and doing so well, because we work so hard. I can tell you, people of our background, we work so hard. So it would be nice to see us, in various places, in various departments, in various occupations. But then again, if nursing is your calling, please do nursing, because I love nurses, okay? Don't just do nursing as a means to an end. Do nursing because that is what you are called to do, okay? All right, thank you so much. My next video is about other jobs that people take for granted, and those jobs make you really good money. Okay, stay tuned. Bye, take care.